Good afternoon, everybody. So I'm here to present an unusual case of posterior scleritis. So we had this a very young girl, 25-year-old girl, who came with us with complaints of redness, pain, and defective vision in a right eye for 1 month duration. She had occasional joint pain and low-grade fever, and she's been having the same problem going on the last 4 years, and she's already been using oral immunosuppressives. On examination, she was obese, she was pale, her pulse rate was very less, around 60, which was low in volume, and her blood pressure on the right arm was 100 by 70 millimeters of mercury. The rest examination was within normal limits. Coming to the ocular examination, the best corrected visual acuity in right eye was 3 by 60 and left eye was 6 by 12. The conjunctiva showed an inferior scleral congestion in both eyes, and the cornea had few fresh fine keratic precipitations in the right eye with mild anterior chamber inflammation going on. Sorry. And you can see the inferior scleral congestion in both eyes. Coming to the fundus picture, the right eye had a pale disc with diffuse choroidal scarring with minimal serial detachments, and the left eye had a prominent disc edema with posterior choroidal folds. We went ahead with the B-scan ultrasonogram, which showed us the typical diffuse scleral thickening, almost 1.96 and 2.33 in both eyes, with subcutaneous fluids related to a posterior scleritis. Except for an increased white cell count, ESR, and CRP, the remaining investigations were negative. But what came out as a surprise was her ultrasound finding, which showed a very small left kidney and calcification of her upper abdominal aortic valve. We went ahead with the CT imaging, and what we saw was a typical calcification noted along the abdominal aortic valve with thickening and suggestive of Takaiso aortoarteritis. A CT aortogram was then done, which showed us the typical stenosis of her both suprarenal as well as the infrarenal abdominal aorta, with moderate thickening of the right renal artery with very severe stenosis of the left renal artery and a shrunken left kidney. The patient was already on immunosuppressives. She was already using mycophenolate mofetil, and unfortunately, she couldn't afford for further new or biological techniques. And when consulting with local dermatologist, she was advised to take tocilizumab, which she couldn't afford. So, and she was from Goa, so she had to go back, and we're still waiting for a follow-up. And we went back to the patient, and we examined her left arm did have a very less systolic BP compared to her right arm. Again, pointing towards the diagnosis of Takaiso arteritis. Takaiso arteritis is a very rare chronic obliterative vasculitis affecting the aorta and major branches. It's a T-cell mediated autoimmune inflammation of the vasorum, which progresses to fibrosis and the resultant features. Takaiso retinopathy is the most common finding which you see in this kind of patients, which basically is because of the ocular hyperperfusion. We see microaneurysms, arteriovenous anastomosis, and neovascular complications. And the most important aspect is to treat the ongoing inflammation and to control the hypertension if necessary because of the renal artery stenosis. To conclude, for a general ophthalmologist, it's very important not to miss such cases. And presenting as a posterior scleritis in Takaiso is pretty rare, so we should have a wide presentations regarding these diseases. And probably for such patients who are very young and very they have a lot of life expectancy, probably we should switch over to novel biological therapies if they can afford, to make sure we don't avoid the adverse effects of steroids. Thank you.